So maybe your tick isn't carrying any pathogens. That would be great news. Or maybe it is, and then you know which ones they are and what symptoms to look out for or what prophylaxis to take. So now we can think about, do we want to begin treatment? Do we want to do some kind of prophylaxis treatment? So if you don't have symptoms, you may want to still take some action in this way. It's up to you. I work with a lot of people and everybody really, feels differently. Some people have already had Lyme or know people who have had Lyme and had a really hard time with it, and they want to be really proactive. So, that's great. Some other people just want to watch and wait, and that's okay too. So just to give you the options, you can think through it or think through it with your healthcare provider. So the pharmaceutical treatment, this is the ILADS guidelines. So you won't come across this if you go to the urgent care, ER, or normally your primary care, unfortunately. But what the ILADS guidelines say is to consider a 20-day course of doxycycline after a tick bite, especially within 48 hours. Now, while we could do that, I recommend also, or instead of, taking what's called the deer tick bite formula. Now, this has a list of herbs in it that helps your body to kill the pathogens that can be transmitted by a black-legged tick. So, as you might know, herbs have many different properties, many different compounds that work in a lot of different ways. So whereas an antibiotic like doxycycline has been created to really work in a particular way, and it might do that very well, these herbs are helping your immune system work better in the face of Lyme disease or other tick-borne disease, which is very different, which is of great benefit, of course. It also targets the spirochete form of Lyme and the round body form of the Borrelia. And then thinking about the black-legged deer tick, we're going to think about these other pathogens it could carry, and also targeting biofilm to some degree. It also protects joints and the neurological system, the liver, things that are really helpful in the face of Lyme or tick-borne disease. So in creating this formula, one great resource is Stephen Buhner, Healing Lyme. He has some other books too. He's amazing. But also there have been studies more recently in the last 10, 20 years, which has been really nice to see that coming out around herbs and specifically Lyme and tick-borne disease. Now this is one called Cryptolepis, and I really enjoyed learning about this because Cryptolepis has been used for the treatment of malaria in Africa for a long, long time, and there's a lot of research on it, and it's very effective. And it's been shown to be protective when used as a prophylaxis. So what I was thinking was, well, if we know that it treats malaria and it's used as a prophylaxis, and then we have other studies here that are coming out where it's actually effective against Borrelia burgdorferi, then why don't we use this as a prophylaxis for Borrelia Lyme and other tick-borne disease, right? So there's some more recent studies looking at Cryptolepis, and then Juglans nigra is black walnut, Polygonum cuspidatum is Japanese knotweed. We've got Artemisia, Uncaria tomentosa, that's cat's claw, cystis, and Scutellaria, Baikal. So it's Chinese Baikal skullcap. So those outperformed cefuroxime and doxycycline against growing and non-growing forms of Borrelia burgdorferi. So this is wonderful, that we're having studies come out of Johns Hopkins now that are being funded to look at botanical medicine. Yeah, we could go down that path, but for today we're focused on prevention. So thinking about the formula to create that I created way before this, actually, so this was just extremely validating. We also look at other studies like how Cryptolepis and Polygonum, which is knotweed, are effective against Babesia. So great. So let's see, what am I using in my formula? Yes, we have the Cryptolepis and we have the Polygonum. which is knotweed, and then cat's claw, which was also mentioned, and then houtunia. So thinking about, and actually now we can even update that further, but anyhow, looking at the target, the target pathogens. And, if we do simplify it, of course, these herbs are doing more than that, which is important and excellent. But if we're really just looking at the antimicrobial effects, this is what this slide shows us. And then this is the dosing. So, for those of you out there who might be herbalists or be interested in creating an herbal formula, I have that information in the book, how to do that. The deer tick bite formula, you could also just buy each of these ingredients separately, although some of them are hard to find, like Cryptolepis. Or you could purchase this in and of itself. And so then you have the dosing there. So after a tick bite, it would be 1 teaspoon 3 times a day for 30 days. And then some people, will take this, if you're a high-risk population, you might want to consider it daily during tick season, so to speak. Okay, step 5 after a tick bite, we're going to watch for symptoms. So this is a long list of symptoms. We've reviewed the signs and symptoms of the top 3 tick-borne diseases. And here it is again. Of course, report that to your healthcare provider, hopefully a Lyme literate healthcare provider if that happens. And then step 6 could be get tested. So this may or may not be necessary. If you have a erythema migrans Lyme rash, that we don't want to wait to get tested, because this is quite a story unto itself. But for lab testing, Lyme is not going to be accurate until 4 weeks after the bite. So if it's 1 week, 2 weeks in, and you have an erythema migrans or obvious fever and joint pain or something like that, we want to just treat you. We do not want to wait or do a test at that point and then it's negative. Unfortunately, I hear that a lot. Oh, the test was negative, but it was only 2 weeks after the tick bite and you have symptoms. Let's treat you, right? So anyway, each test is different. Anaplasma, like I said, is actually easily tested, or accurately, I should say, tested early on. So that's fine. But each pathogen is different. It just depends. So a tick preparedness kit. So I do make these, and it has all of those in that we talked about, going through the different steps. It has all of the contents that I talked about, which is a nice pairing to the book. All right, so now we're almost there. Thanks for hanging in with me. I hope this has been helpful. We're going to just cover a little bit about acute Lyme and tick-borne disease treatment for those 3 diseases that we've talked about so far. So here we go. Lyme disease or borreliosis. So again, just to mention the 2 standards of care, IDSA or CDC versus the ILADS guidelines. So just to highlight again a little bit about the ILADS guidelines, there's evidence indicating 20 days of prophylactic antibiotic treatment is highly effective for preventing the onset of Lyme from a black-legged tick bite. But really, patients with Lyme might be served best by receiving several weeks of antibiotic therapy. And so because there is a such thing as chronic Lyme disease, it really requires individualized treatment. It really takes a skilled practitioner to review the history and the symptoms and which pathogens might be present, testing or just looking at the clinical picture to really carve out the right treatment for you. So here we have our shapeshifter again. We've got the spirochete form, the round form, and the biofilm for Lyme. So we'll talk about Lyme treatment first. So this is just like a typical template for acute Lyme. So I work with people with acute tick-borne disease as well as chronic. So chronic infections might be a different story. We might start here for sure. It could be a good template, but it just could look very different. If you came in with an erythema migrans or acute fever, and we're going to get started, that's what we're going to talk about here today. So doxycycline, please note that there are some avoidances of calcium and calcium magnesium products because it interacts with doxy. And you can also have some sun sensitivity, so just something to watch out for as we get into the summer. That's very important. It seems like sunscreen doesn't work so much, but like if there's zinc in it, you really need that blockout effect of the white zinc oxide. That is more effective, or just clothing to protect yourself. Now there are other options, if there's an allergy, or if you're near the equator during the time and we're just not going to chance that sunburning, because it will happen. You can use cefuroxime or zithromycin. And then I always add nystatin, so that's an antifungal. So the doxycycline can, obviously cause some trouble with the microbiome, and we want to decrease that fungal overgrowth if it's going to happen, especially in women, because sometimes, if we're doing a start of 30 days on a plan, that's a long term for antibiotics, and so we want to protect you from getting like a yeast infection. Then we can add to that. So there are many options. That's the thing. There are many options. This is just one way to go. We can use what I call Lyme formula, and that has cat's claw, Chinese cat's claw, Japanese knotweed, and andrographis. And as Stephen Buhner has put together his amazing work on this, there's a literature on how these are effective against Lyme, and so we could use that. Or because it's paired with doxycycline, we could use grapefruit seed extract, which gets to the round form of Lyme. The herbs here, they get to both the round form and the spirochete, whereas doxy is just getting to the spirochete. Now, for people who are really suffering with symptoms, we might want to add this Lyme too. So it also has puraria and red sage and Baikal skullcap, and those can be really useful if there are a lot of neurological symptoms, or if we want to boost their immune system just a little bit more. So that's optional. And then serrapeptase is going to be our anti-biofilm agent. So that would be important to add to break through the biofilm. And that must be on an empty stomach. And then probiotics I always add in order to also mitigate those effects of the antibiotics. So now we're going to go through anaplasmosis and that treatment. So acutely, which is really, we don't see chronic anaplasmosis like we do with some other tick-borne diseases. So again, high fever, worst headache of your life, go to the ER, get tested, treated right away. People do very well. So it's doxycycline. The thing is, doxycycline is really almost the only appropriate treatment. It can be used in children. There's just a side note. We don't have too much time, but there was some older thinking based on tetracycline, not doxycycline. They're in the same classification of drug, but there was this thinking where it can affect the enamel of teeth and not to give it to children under 8 years old. But there is a lot of newer studies showing, no, actually you can. And this is really important actually with a different disease called Rocky Mountain spotted fever. It's so important to treat people as soon as possible for these tick-borne diseases. Anaplasma, you could use rifampin. It's an alternative. It is not in Rocky Mountain spotted fever. You need to use doxycycline. So anyway, just to say, not to limit the efficacy, you can't use cefuroxime for anaplasmosis. So it's really important to get the right drug. Okay, so we've got doxycycline, and then also you can add nystatin as an antifungal. And then we've got some herbal support you can use. So there's houtunia and red sage, astragalus, puraria, which is also called kudzu, and Baikal skullcap. So these can be effective against anaplasmosis or ehrlichiosis for that matter. And then we need some antibiofilm effects, serrapeptase, and the probiotics to come in because of the change in the gut flora. All right, so our last pathogen that we're going to talk about for today, acute babesiosis treatment. So again, babesiosis is from a parasite, Babesia, or a protozoan called Babesia. So it is treated differently from Lyme or Anaplasma. So it's important to know if you have this and to treat it properly. Atovaquone is used and with azithromycin. So you need both together. And again, there are other options, but this is, for the sake of today, the template of what to go to first. So atovaquone, just a note to take it with fat to make it more effective. Do not take it with CoQ10. It will decrease the efficacy. And you may, it's really long-term use. You need to check liver and kidney function. Azithromycin is just once a day, not twice. A lot of things are twice a day. And then, so that's the pharmaceutical, those two together are the pharmaceutical protocol for babesiosis. Then we can also add some herbal support with Babesia formula, which is Cryptolepis, Seta acuta, and Bidens. And I use that a lot. Like when we move on to if we're dealing with chronic Lyme, or if we need to treat a little longer, I will, transition people from pharmaceutical inclusive protocols to herbal or natural therapies. So, we might start with pharmaceuticals and then move on to Babesia formula. There are a lot of ways to do it. But before I forget saying this, it's really important to treat 2 months past the resolution of symptoms, whether it's acute or chronic. So if you had a bullseye rash for Lyme, for instance, something obvious, or, just the fever and flu-like symptoms and some joint pains, whatever it is, we want those target symptoms to resolve. And then that's where we start the clock on the 2 months. Now, it might only take a week or a few days for those symptoms to resolve in acute issues, which is great, right? But you need to count those 2 months. So in those 2 months' time, we don't necessarily need to use pharmaceuticals the whole time. I'll often move on after the first month of pharmaceuticals, depending on the situation and what we're dealing with. Everybody's different, right? But we might then move on to the herbal antibiotics at that point. Okay, that was important to say. So back to babesiosis. So we've got the pharmaceutical protocol, we've got Babesia formula, and then we've got also, because it's very useful for Babesia because of how it affects the red blood cells, getting that red sage, that Salvia miltariza root formula in there can be very helpful. And then serrapeptase, just like with everything else, as one of many options as an anti-biofilm agent to break through that biofilm to get to any of the pathogens that are in there. And then the probiotics, because you've got that azithromycin in there to balance the gut flora. And just to note, the atovaquone is anti-malarial, so we don't see too much in the way of change in gut flora so much with that as we do with antibiotics like azithromycin or doxycycline. But it has been shown with babesiosis treatment that the atovaquone and the azithromycin together just work better. They synergize in a way that gets to the Babesia pathogen better. All right, well, I think we've covered all of the tick-borne disease treatments for today that we have time to cover. So please join me. Let's end the Lyme and tick-borne disease epidemic through prevention. Please spread the word. I really hope that you have a healthy, happy life, free from tick bites and tick-borne diseases. You can find me at dralexis.chesney.com.